Community Medical has created a command center in order to improve their facilities, patient flow, and quality care. However, Community Medical still faces three challenges, which are to develop a culture that is accepting of a new model of a patient flow, encourage innovation and individual change agents to play an active role, and improve workforce engagement and Q12 engagement scores.
To develop a culture that is accepting of a new model of patient flow, there are four types of suggestions. The first one is compensation. Changing the compensation of the individuals involved in the new model to motivate the employees. For example, giving a reward to an employee who work well in the new model. Making time to involve all levels of employees, for example, making time to talk about a new model every week with different departments. The human resource teams should establish roles and responsibilities relating to the innovation. The second one is communication. Frequently and rapidly communicate with people by using several kinds of communication channel, for example, email, newsletter, and video clip to communicate with employees. Using a consistent and cohesive communication strategy as communication tools, for example, start the communication from the top to the bottom. The third suggestion is training. Involve new method, ideas, law, and responsibility, and building a new network relationship, and also evaluate team skill capabilities. Find out improvement strategies such as low risk strategy and big bang strategy, and also learn about using a method called Six Sigma. The last suggestions are goals, measurement, and metrics. Measure idea, involvement, and time by holding a meetings. Identify the return and new idea by analyzing a new idea and understanding what is happening of the progress of the new model by communicating frequently with employees.
In order for employees at the community medical center to adjust to the new changes, they will need a change agent who can step up and make the process much easier. Change agents must learn how to encourage innovation at the hospital. They must also understand that being authoritarian will not help them achieve their desired goals. Instead, a change agent must learn how to efficiently express their desired vision of the medical center through working with the rest of the employees. To encourage innovation among the employees, the strengths and weaknesses must also be learned. Demonstrating flexibility and resilience will also be crucial for change agents. Once the command center is up and running, change agents will be faced with understanding how to work with an assortment of different patients that go through the command center. This will be difficult, and in order to be successful, these change agents will need to adapt to all situations and setbacks as they occur. Since the command center will be new to most employees and patients, change agents must anticipate setbacks that will come. Change agents need to also realize that they must lead courageously. If they desire to change the work atmosphere of the community medical center, they must take charge of all situations regarding the command center. This will involve making tough decisions and facing tough challenges that come. Changing the hearts and of minds will not happen over time, and change agents must anticipate backlash from fellow employees and patients who will not adjust.
To understand how to improve workforce engagement and Q12 engagement scores, there needs to be a clear understanding of these terms. Workforce engagement is the employee's commitment towards the organization's goals and visions emotionally and intellectually. Q12 engagement survey is a 12-item survey created by Gallup and used to measure engagement. If community medical improves its workforce engagement, its Q12 engagement scores will also improve too. To improve work engagement, the involvement of the organization and its managers are needed. 3 ways community medical can improve work engagement is by integrating coaching into the organization, using correct strategies to become an employer of choice, and having managers use action planning. In addition, these 3 methods may also help speed up community medical's diffusion of healthcare innovation. Many healthcare organizations such as Trinity Health System in Steubenville, Ohio, are finding positive coaching as an effective way to increase employee engagement and increase quality care. Community medical should use similar methods as Trinity Health System by conducting a 2-day leadership development institute to teach managers about coaching as a core skill set. Managers then can combine and use on-the-job coaching with other best practices like goal setting and ongoing performance management, which will help improve manager and employee involvement. Bob Carden, CEO of Richmond-based Virginia Blood Services, used successful strategies to make his organization become nominated twice as an employer choice by Richmond Human Resource Management. Community medical can become an employer choice by using these strategies that Carden had used, by giving meaningful work, provide training, have compensations and benefits, have inspiring managers, and have a good workplace culture. According to Gallup, 6 steps are used to have an effective action planning. Managers should introduce the action planning session to employees, distribute and explain the survey results, discuss the results' benefit to the group, select key items, brainstorm, and follow up regularly on the plan. In conclusion, the research and methods mentioned are not always 100% effective or the solutions to the 3 challenges community medical is facing. Therefore, there will be more needed research and trial and error. As community medical grow and progress forward, they will surely resolve these challenges.